Hi, everyone. Thank you for coming. I'm Catherine Record. I'm in the Health Law Society with Tricia Hammond and Kristen Wolf and Gerald Chen, who we all planted this with the American Constitution Society. And we really are glad so many people are here. This is great. Professor Charles and Professor Richmond are going to talk about the economics versus the politics of healthcare reform. And they're planning to speak each for maybe 5-10 minutes each, and then they would love to hear from you, so feel free to ask questions, make comments, disagree, agree, whatever. So thank you. Enjoy.
So how many of you would like to double your income? Exactly. We're here to talk about how we should be talking about healthcare. And I'm not always this banal, but when it comes to healthcare reform, the only way to talk about it to make it work is if we completely ideologicalize it, remove ideology, remove emotion for that matter, and say, look, there's a lot of money on the table, and it's our job to pick it up and make it work. Anything that distracts our attention from that pile of dollars on the table is only destructive to achieving what are really necessary, but nothing more than common sense reform. In that sense, this is a world where the political scientists have got to take their little surveys and catchphrases and go home and get out of the way of the economists who can really figure out how to make things work.
Have you seen the way the world has fallen down in the last year? Where were the economists when we needed them?
We were correcting the math.
So here's the perspective that I bring to this. I think it is true that the economists will tell us that, hey, this is the way the world ought to work. The problem, though, I think, is when you start framing these debates, and you've seen that with the way that the president has approached it. So from the very beginning, he approached it from a very self-interested perspective. This is going to be good for you. If you have health insurance, nothing is going to change. If you don't have health insurance, you're going to get it, and it's not going to cost us more. In fact, it's going to cost us less. And what you saw are people being very skeptical to that approach, because what they're really wondering about are the underlying fundamental policy values that healthcare reform represents, especially this notion of the role of government in particular, and trust in government and being able to do this. So if you're going to have a purely economics debate without a larger notion of the moral values that are involved and the fundamental values that are involved, healthcare will fail, and you see the president shifting his strategy in response to that perspective, which is why the political scientists have a better view of the world, because we tell you exactly how the world does work as opposed to how the world should work if you had a can opener.
The political scientists are out there to confuse you, distort you, and manipulate you. What are the moral values that are at stake? Is it liberty or is it security? Well, they'll tell you it's both, depending on what mood you are in when you wake up. The truth is, actually, reforms are completely destructive when you talk about those inaccessible values. What we have in the healthcare system right now, and there's a reason that a very formidable politician, the president, has started talking about it this way, is because once every person in America understands how completely screwed up our current system is, how much those who have insurance are paying and getting nothing in return, how costly it is for employers, how costly it is for those both with and without insurance, how costly it is pretty much for everybody except for the docs, who, by the way, are not terribly helpful, although they are very good politicians. Once we realize that that's what the story is about, then we will remove all these ideological baggages and we will talk about efficiency. Economists are not always good at talking about the First Amendment. They're not good at talking about, I don't know, states' rights, whatever else might be important to people.
Or anything that is important to people.
Or anything that might be important to those who are emotionally sensitive. But they are very good at figuring out common sense. And it just so happens that without pursuing common sense, we will bankrupt the country. In fact, actually, the current financial crisis is due to the healthcare crisis more than anything else. And the reason we have a deficit is not because of wars or tax cuts, but it's because of excessive healthcare costs. Now, we can ideologicalize all that, and that's what Guy wants to do, and that will make, you know what that'll really do?
They're
If
clear.
you really, yeah,
I'm
if,
sorry.
yeah.
I thought you were done.
That was a dramatic pause.
Efficiency.
I'm learning something from my colleagues here. It's the effect of the dramatic pause. The dramatic pause will kill any legislation, no matter how valuable. Here's my dramatic pause. If what you want to do is gain political points, then you will resort to an ideological debate. If what you want to do is fix perhaps the most severe problem in the country right now, you will talk dollars and cents.
Well, there are two clear and easy responses to that. The first is ideology is inevitable. And you see this when the president first started talking about this in purely self-interested economic terms. So everybody was going on the other side, well, your cost numbers are wrong, taking issue with the very specifics that Professor Richmond is talking about, because both sides have a particular view, both sides have their economists, and even though the president might be able to say the better views that we're going to bankrupt this country, and I do agree with this is one area that Professor Richmond and I agree. We both agree that of the underlying facts. The problem is if you frame this in the terms that the president started, where he started, and framing it in those terms, you get exactly what he's been getting, which is a dispute and a debate on those very same notions. So, for example, when he says it's going to cost X amount of dollars, everybody says, well, wait a minute, you're underestimating the cost as well as you're overestimating the cost, both of healthcare reform as well as the benefits that your program is going to give. When he starts talking about this, so this is the second point, when he starts talking about this more in terms of the role of the government, which then begins to tap into what people are concerned about, that's where you start seeing a little bit of movement. You're not going to get health care in this country, or at least the type of health care that the president really wants, unless you have a fundamental values debate, unless you understand what the role of the government is and ought to be, and why health care reform fits into that values debate. And when you saw the president the last time he spoke a week ago, he incorporated much more of those moral views, those values views into his discussion because he knows that's how you need to reach the American voter. Yes, it's great for the economists to talk to the political elites. And when you're talking to political elites, it's great to get to the bottom line numbers and the efficiency. But when you're talking to the American voter, that is simply not just going to do.
When you talk to the American voter, the only ideological perspective you should have is, do you or do you not want to double your income? And I'm done.
We'll open it up to the rest of you.
In the spirit of debate, I don't even know if we should bother raising hands. I just shoot it on that.
Is there just one right answer then?
Actually, I did call on somebody.
The bait and switch of the economists.
Actually, Catherine, maybe you ought to do that. Why don't you take care of the hands? Because Guy and I are just going to want to selectively, pick the people that we planted in the audience.
Somebody in that row back there.
Well, I'll speak. So you guys are obviously talking about economics versus politics, but where do you actually stand? I feel like you can make those things coincide. I mean, where do you actually stand on public option, all those things? How do you think that fits into economics and the politics? Do you think that's good? Do you think that's bad?
That's a policy question. I didn't know we were going to get policy questions. I'm not crazy about the public option, but, it's actually funny. What Guy said a moment ago about the president's speech last week, I thought that speech was fabulous, but not because of the last 10 minutes, which was really stirring. It was the first part. Look, some people on the right want to do this, some people on the right want to do that, but we all realize that we're spending too much. We realize that there's a lot of waste in the system. Public option, look, it's a reasonable idea, but it's not a good ideological idea. And none of us should feel happy that the government, as an inherent matter, has a role in the healthcare marketplace. We should view it as a way of expanding access and reducing costs. And if we have another way of doing that, and I happen to think that there are better ways to do that, but if there are other ways to do that, then there's nothing that we should lament about not having a public option.
I'm generally the same view. That is, my view on the public option is if it makes good economic sense, that's fine. If it doesn't, then there's no reason to stick to it. So so this is where I would agree with Professor Richmond. From an ideological perspective, The question simply is, what is it that's going to work? But you can't separate that from how do you engage fundamental reform and a democratic polity. You can't simply say, hey, I'm the person who knows best as to how this is going to work, and this is exactly how we're going to do it. It needs to be sold in the language and in the terms of democratic politics that Americans respect and understand. So my own individual views to say, public option makes no difference. It's simply a question of, does it work? But in terms of how you have to communicate with the American people, I think that's a much more important and fundamental question.
That's just another way of saying we need scare tactics. We need scare tactics to stop reform. We need scare tactics to create reform. But absent scare tactics, we're not going to mobilize the politics.
I'm sorry, but this is politics, all right? It is not an Alice in Wonderland approach. You have to explain that when you tell people,
Maybe he doesn't want
do
to
you
double his
want
income.
do you want to double your income or not? That is not scare tactics. That is not an emotional appeal. That is simply an appeal to rationality, right? So the politics
And the common sense.
The politics are as important as the policy. And if you're going to be a politician or making political arguments, you have to recognize that and understand it. It's just sort of a fundamental reality, and I don't know how you can avoid it.
Okay, the guy in the blue.
Question for Professor Richmond. You were talking about eliminating ideology, and I guess my question is sort of twofold. First of all, how, without the assistance of political statecraft, could you just sort of wave a magic wand and say, oh, no one's going to use ideology anymore? Like, how is that practicable? And second, this vision of a world where everyone is sort of homo economicus, isn't that an ideology?
Well, I'll probably grant that second question. Yeah, I mean, yeah, the fact that people would like to supplement their income, I suppose that's ideological. It's an ideology that I find fairly, predictable, and not so easily manipulable. But the first question is really the main question. I'm not about waving a magical wand. I'm about saying to the American people, look, we have a severe problem here. And the problem is, the source of the problem is largely inefficiencies. If we get together and figure out in a mutually beneficial way how to fix things, we'll be able to pick up the $2 billion that just happen to be lying down on the street. If, however, we decide to discuss this in ideological terms, the $2 billion will stay on the street. It's not an effective strategy.
Since so much of our politics involves placating the business sector, wouldn't it be better to find a way to have health insurance not be on the hands of employers?
Well, okay, this is interesting. I wonder if Guy's going to agree with this or not. When an employer, and this is important, this is very important, because this actually is why people don't realize that they're getting taxed. This is why they don't realize that they're paying far more than they should. When an employer pays for your insurance, that's not an act of generosity. That's coming out of your pocket. In states where there are, empirical studies have proven really, that every dollar that an employer pays for your insurance is a dollar taken out of your pocket, okay? The employers are not doing this for their own economic benefit. Essentially it's a mutual agreement between employers and employees. It's largely driven by the tax system because every insurance benefit that the employer pays on your behalf is not taxed. It's a real loophole. And one of the very obvious reforms that economists love and politicians can't seem to, or political scientists can't seem to realize how commonsensical it is that we ought to tax those benefits. That way, you wouldn't essentially have a loophole that would drive investments towards really expensive insurance plans. So once we realize that when the employers pay things on employees' behalf, that's really the employee's money, and it translates in a reduction of the employee's take-home pay, then we realize that, look, this is not a story about generosity, and it's not a story about security. It's a story about inefficiency.
There isn't much that I disagree with there. The policy prescription on whether you're going to tax employee benefits, again, is not one that you look at the American people and you say, well, gee, this seems to make a lot of sense to us, and that's exactly the way that we're going to do it, as you rightly know, right? There is a reason why politicians have basically avoided, except in admirable circumstances, avoided talking about this in these particular terms. So if, on the other hand, you begin with a proposition, as the president has started to begin with that proposition, that you can't live in a 21st century democratic polity, an advanced democracy in which you have a large number of individuals, significantly large number of individuals without health care that is not consistent with how we conceive of our fundamental rights, then it's a lot easier to say, and this is how we're going to pay for it. It makes no sense to me, even as a non-economist, coming from a political science perspective, to say, well, you're going to have health care, it's going to be great, and it's going to cost nothing to anyone. Right? That is not a perspective that I think works for the American electorate, and they're justifiably skeptical. But if you begin with the fundamental proposition, then you can talk about and think about whether taxes and taxing health care benefits is the proper way to go because it is efficient or because it has certain savings from an economics perspective.
So what is the fundamental perspective? The fundamental principle?
Well, it seems to me the fundamental principle has to be some notion of caring and concern for our fellow individuals. And you saw the president, you didn't like the last 10 minutes, which I was thinking about you during the last 10 minutes of the president's speech.
It's just emotion and words.
Yeah, it's just emotion and words. And it's these types of emotion and words that move people to particular policy considerations. And this is the way that he articulated it, right? He articulated it in the sense that you have to care for your fellow human beings, even when it might cost you a little bit more than you would want. If we don't frame it in those terms, maybe we don't want health care. And that's also, right, that's also policy prescription that has to be on the table.
Yeah, I mean, be that as it may, it is true. I happen to subscribe to the view that, we ought to care about each other and we ought to make donations to support each other. But once we start talking about healthcare that way, then that takes our eye off the ball. It is true. It sounds like a sleight of hand that this isn't going to cost anymore.
But we have been talking about it in the terms that you want, and it's been extremely difficult to make any progress. And it isn't until we shifted the terms of the debate.
The reason it's been hard to talk about, how inefficient Medicare is, for example, is not because we disagree on the numbers of Medicare. It's because there's the suggestion that there's death panels floating around, or that we're fear that there's going to be a government takeover, or there's a fear that we're no longer going to be able to exercise our unalienable right to select our doctor.
But the truth of the
these
matter,
are all things that confound the real point.
But the truth of the matter is, if that's what people are worried about, then those are the issues that have to be addressed head on. Right? You can't simply say, those are emotional, forget about those. Let's focus on the economic underlying efficiency policy, right? If people are concerned, right, if they're concerned about death panels and they're concerned about all these types of questions, you have to address it. And you're seeing the White House. So there's an article, I think, in the New York Times today with the White House Rapid Response Team, which is basically, let's address all the kooky ideas that are out there, right?
Right, address the kooky ideas with both practical responses. I mean, look, we can emote over the value of caring about each other or the value of the government infringing on our liberties all you want, and that's a recipe for doing nothing.
My question is to what extent the political science response fails in light of extreme partisanship in Washington. I feel like even when the president was talking about it in economic terms, he's talking about it to his Democratic audience, to the Democrats in the room. The Republicans, well, we're just going to slam it, shove it down your throat, whatever. So don't you think that in the end, if they're going to turn to a political science, sort of discourse, they need to address that half of the room or even the quarter of the room that's left?
Right, and this goes to the question that Mr. Fitzgerald asked Professor Richmond a little bit ago. You can't take ideology out of politics, right? So the question is not taking ideology out of politics. The question is cabining ideology. I mean, this is the genius of American politics, is how do you cabin distinctive interests and force them into particular positions that works for the polity? So It may be at the end of the day that the president is going to have to go at it alone. But the goal can't be to take ideology, especially ideology, out of a reform that is fundamental to what it would be probably the biggest 21st century reform, leaving aside sort of the emergency TARP things that we've done. But this would be fundamental in terms of the way that it changes our society. It's similar to Medicare. It's similar to, I liken it to the Civil Rights Act of 1964. You can't take ideology out of those conceptions, and it may have to be that the president goes at it alone if one believes that that is the mandate that he has, and that's the proper thing to do.
This is not like civil rights reform. This is more like no-fault insurance. No-fault insurance. Who gets excited about no-fault insurance? Nobody. But once Massachusetts tried it and they realized how much money they were saving consumers, every state in the country pursued no-fault insurance. That's all this is. We're just trying to rejigger the rules so everybody gets more money. How's that complicated? Now what's interesting about...
Why would anybody object to that? What's wrong with the American people? They must be stupid. They don't understand.
That's exactly right. They don't understand. And the reason they don't understand is because bloats like this guy keeps infusing ideology in the discussion. Now, what's interesting about the question that was just asked, don't you need to come up with some language to mobilize the other side? It's sort of like how good judges can distinguish any case that they want, right? This is something that we're all familiar with. Guy's very good, and his brethren and sisters are very, very good. They can spin any issue into a heart-wrenching, morally repugnant story. And that's what's happening. And to the degree that Obama, as talented as a politician as he is, comes up with a very appealing narrative that should appeal to both liberals and conservatives, there are spinmeisters out there who 5 minutes after speech are talking a different story. That's not going to work.
But
no-fault insurance is a wonderful way to talk about health care reform.
That is inevitable no matter how you shape it. That depends upon if you really believe that you could take the politics and the ideology out of this and it will work. If you believe that, that is fine. You and 5 other Sarah Palins can decide which part of Russia that you want to live in, right? But I don't think you can.
Now that's a death panel I'd like to be on.
Okay, so I had a lot of remarks I was going to make. I'll just go through them briefly. If my history is correct, healthcare really took off. Health insurance took off when Nixon imposed wage and price controls, and employers needed something other than just plain more money to lure employees into working for them. And the current housing disaster basically was caused by federal policies of getting people into houses into home ownership, who really couldn't afford to do more than rent, on the idea that home ownership was the American dream, even though, frankly, for most people it makes economically no sense. I'm a little afraid that any policy driven by ideology will infect the entire system it creates with an ideology that, frankly, may not be mine. And I don't really want my health care or my newspapers or a lot of other stuff driven by somebody else's ideology that I don't necessarily agree with. But more importantly, are we talking universal health care in the real sense of everybody, not just American citizens, not just some geographic line drawn on a map? Because frankly, to be honest, there's only a couple of hundred people in the world I give a damn about. And most people are like that. When you get beyond paying lip service, and when you get beyond politicians just trying to buy votes, how many people in the world will you really, go to the wall for? And I don't really. And there's a billion people getting inadequate.
You're right.
There's billions of people getting inadequate health care and not enough food and all kinds of other problems. Frankly, I don't care. If I cared, I'd be giving all the money I'm giving to this place to them. And I'm not. My actions say I don't care. My mouth isn't going to controvert that.
Well, I don't understand the premise that you don't want any policy driven by ideology. All of our policies, including your statement, is driven by your particular ideology. What do? You elect people who are similarly minded and who say, we only care about the 20 people that we care about, right? And then there are other people on the other side who say, no, our circle is bigger, and we have a debate on the policy considerations. But this idea that our ideas are outside of our ideological conceptions, to me is very, very difficult to make sense of, right? Because the perspective that you articulated is a particular ideological perspective. And and the other side of that could be universal health care, and that's a particular ideological perspective. Some people are going to win, and other people are going to lose. And fortunately, in a democracy, we get to vote for those types of people, and hopefully they're honest with us about what it is that they're going to do, and the process is sufficiently transparent so that way we can understand what is happening and decide whether to vote them or whether to vote them out or to keep them. But this is an ideological debate. This is the fundamental difference, I think, between us. This is an ideological debate whether you like it or not. All right? So if it is an ideological debate, if people are worried about death panels because they're worried about the role of the government, if they're worried about their taxes going up because they're worried that the government is going to take too much from them, you can't run away from the ideas that are the underlying ideas that comes from a particular ideology, and it has to be addressed head on. And that, I think, is what I'd like to leave Professor Richmond with.
Discussion of ideology probably misses to some extent the point. Economics is, I mean, I believe that economics is a way particularly to address and parry that ideology. I mean, oftentimes you refer to death panels as part of that ideology. That's simply not a component of a plan. So we're no longer debating ideology. Should we have everybody insured or should we not have everybody insured out of some sense of moral obligation or compassion? If you talk about it in purely economic terms, it's something that can appeal beyond individual ideologies because it addresses a specific interest. Even if I were to only care about 20 people, which is not true, universal health care would lower my costs, which means it appeals to somebody who only cares about 20 people and to somebody who cares about everybody.
But again, the point is, this has been tried, and it has been tried, so this is where the empirics of the economists should really come to the fore, not just of those of the political scientists. It has been tried. It isn't the case, and you saw the president do this, especially from the very beginning. His articulation early on the reasons for health care reform was extremely narrow and in self-interested terms. This is going to help you. Let me talk to you who have health insurance. Let me talk to you who don't have health insurance. The point is, if you're going to pass policies through, some of that is going to appeal to certain types of people. But what this has demonstrated, what this healthcare debate has demonstrated, and what politicians have long known, right, from time immemorial, best represented by Ronald Reagan and his ability to do this, is to take a symbol, to take a conception, to take a view, and to articulate it within that context. So yes, for some people, it's going to appeal to them. This is going to work exactly for you. But what you saw the president start, what you've seen him starting to do, is to expand the way that he's framing this debate. Because simply saying this is going to help you, the other side counters with their own numbers, with their own frameworks, with their own death panels, et cetera, to say this is not going to help and it's going to hurt you, right? So framing it exactly in those terms works for some, but does not work, it's not proving to work for the vast majority. And again, you can't take it out of the framing conceptions.
So one thing that's really interesting, to be non-confrontational for a second, and it'll only be for a second. One thing that's really interesting about this debate is that both of us distrust the other side's methodologies, right? And I think that ideological rhetoric can easily spin in any direction you want. Guy thinks that accounting can be easily spin in whatever direction that accountants want, that these numbers are easily manipulable, and that no matter how convincing one side has for an argument saying, look, this is just going to be more efficient, this is going to create money that otherwise isn't there, this is going to benefit everybody, regardless of whether you have insurance or don't have insurance, whether you're a doctor or a patient or whatever. No matter how convincing those arguments are, Guy thinks that there's going to be some guy with a pencil and a slide ruler somewhere that's going to come up with an equally convincing counter-argument. Now, I think that's interesting. Now I'm going to stop being non-confrontational and return to being confrontational. I think I win this argument, all right? I mean, no matter how fuzzy math can be, it is inherently much, much less fuzzy than rhetoric. Right?
Here's where I think your argument fails, Professor Richmond. if you don't start
I'm
from
actually relieved to hear it hasn't failed yet.
if you don't start from Professor Charles's fundamental principle, all right, we have to care for our human being, our fellow man, etc., and all those fuzzy emotional things. The question is a question of scope. Where does it end? We keep talking about everybody. It's going to benefit everybody. We keep talking about, what this man over here said. It's going to, where does it end? How far, in what sense is it efficient? Is it efficient for the people in this country? And then, if it's only efficient for the people in this country, then what happens? We have more people coming on, more people coming in, and where does it end? I mean, the math might be perfect, but if we don't have some sort of limitation for the scope, or if we have some understanding of who precisely it's going to benefit, then then the numbers could change.
Right. Well, I mean, there are some people who would not benefit from a more efficient American healthcare system. That would be Indian surgeons. All the people who go to India for surgical procedures that, by the way, are have equal success rates from American doctors, and cost about 1/10 of the cost, even including the cost of travel and sleep adjustments and whatever else. Those surgeons will probably lose their market share of American customers who are doing everything they can to avoid an extremely costly and not terribly effective American healthcare system. All right, so for those of you who really care about Indian surgeons, this plan is not for you. For everybody else, and really, this is what's so striking about this issue. There are so many commonsensical reforms, and there is so much inefficiency that rudimentary fixes really will benefit every single American. There aren't a lot of policy issues like that. I am all ideological and even emotional when we talk about America's message to the developing world, or a new foreign policy vision, or even, for that matter, trying to come up with what kind of justice we should appoint to the Supreme Court. These are ideological issues, and I'm happy to engage as an ideologue in all those issues. The problem is that our political reflexes are to treat everything as ideological. And this is one issue that is so critically important and sucks so many of the country's resources and channels them to inefficient ends that we've got to do everything we can to stop ideological talk. That's why the president keeps saying, "I'm talking to you." And if he doesn't continue doing that, then he's going to lose.
But here's the issue. So Barack says, look, this makes so much sense. The stakes are so high. What is the problem here that people aren't getting? Right? And my explanation is the president has been trying to make exactly that point for a very long time. Right? And unless you recognize that you're in a political context, which his team is very good and they're moving in that direction, you have to change the terms of the debate. Right? So you're right, it makes so much sense. The math is the math. All you have to do is present the math to people. Unless they're idiots, they should be able to understand this is in their self-interest. But the fact of the matter, the reality is that we live, the reality, this is being taped, I did not say that. The reality is that we live in a context in which politics infect the way that we do all things, and that's a democratic polity. Now, you could say, let's stop. For this moment, let us quit. No more talking of politics. No more engaging healthcare as a political issue. If that process could work, I would be with you. I'd run over I'd quit teaching law school and go over to the economics department and ask for and beg for a PhD. Right? But the problem is that is not the world in which we live in. So, given the constraints that we have, given the world in which we live in, how can we move this policy consideration forward? If we can move it forward by simply saying, this makes the most amount of sense, you ought to do this is commonsensical, believe in me and believe in it, fine. But that's not working, and it's not working because of the political environment in which we find ourselves.
Speaking of the political environment, it seems that most major reforms have been very politicized and very ideological in their nature. Professor Richmond, do you have an example of any time we've made a major reform based purely from an economic argument like you're suggesting we do now?
I actually think free trade agreements have worked in the past, where essentially say, look, we'll reduce our tariffs, you reduce your tariffs, It means our exporters benefit. It means that our consumers benefit. And for those workers who are in import-sensitive industries, we'll give them trade adjustment assistance. I think that sort of collective action has worked on purely economic grounds. And no-fault insurance.
Professor Charles, to what extent is your perceived need for ideological considerations in politics self-fulfilling prophecy, in the sense that, as you said, since time immemorial, politicians have found that it's easier to appeal to emotion than reason, and so voters have come to expect that? And to what extent is it our responsibility to change the discourse and move away from that and train and educate the general public to expect a different level of discourse?
I think it's a fair question. The problem is, I don't think that in any polity in which people have free choice, that you can persuade them on the basis of simply one way of framing the message. So you might say, look, we need to engage in a concerted effort from here on out to assure that individuals, when it comes to policy prescriptions, respond only to reason. And by the way, I would agree with the statement that Professor Richmond made earlier, that there ought to be certain types of limits. And you saw that, for example, in the presidential campaign and the debate, both in the presidential campaign, both in the presidential primaries on the Democratic side, and then later on in the general election, where certain claims, for example, that were being made by the Clinton camp, and the response to them was, is there a single economist anywhere in the world that understands this view the way that you understand it? And they couldn't point to a single one. Similarly, with respect to the McCain camp. So I do think that there's a limit that one must say, look, facts do matter, right? And as a person who teaches the importance of facts, facts do matter. But taking that into account, I don't think it's feasible to say from here on out we're going to expect the American public or any electorate to respond simply to the articulation of facts exactly as we've done them. You frame the facts in a particular context that responds to the needs of where people are. I think that's part of the political reality. Now, again, as I said, if we can prove that it would be successful to do it another way, fine. But I think, in some respects, we're spitting against the wind.
It's kind of a question for both of you. I read something, and I tend to agree with it, that says that the existence and how Medicare is run is what is preventing the political argument and the economic argument from working and leading to comprehensive health care, because politically senior citizens are the most active, and they have essentially nothing to gain and everything to lose by a redistribution of our health care dollars. And that is kind of when we think of government-run healthcare and what people want, they want, the massive fee-for-service and choice of doctors, and that is kind of ruining the economics because no one is looking at the efficiencies. They want the Medicare system. I'm interested if both of you think that is correct or.
Yeah, this argument is a little harder to make. So people who are not paying for private insurance and current Medicare beneficiaries, the only way you could convince them that reforms would be effective is if you tell them, so presumably they don't care about their kids or grandkids or the solvency of the country, right? We'll take that as a given.
I don't think that's a fair assumption.
Well, look, if it's not a fair assumption, then I really win, right? Because it's the kids and the grandkids who are really going to benefit from reform individually. Even if we relax that assumption, how do you sell this to seniors and Medicare beneficiaries? Really, you have to illustrate how not just costly, but how ineffective the system is. Medicare creates incentives that do not promote the quality of health. Seniors are getting a raw deal also. They're getting a good financial deal. They are extracting a lot of dollars out of the public fisc, if that is something that they might want to do. But they're not getting good health care in return, and that's in part because of the way Medicare is wired.
Yeah, I would agree, and part of it is because I come from looking at health care similar to the 1964 Civil Rights Act, right? And Brock comes at it looking at it as what did you say? It was no-fault insurance. So I
Get
think
any politician excited, right?
I think there is a reason why seniors are afraid. And I think the articulation has to be much broader than the way that we've seen it now, that says to them, look, you have to care about your grandkids and your kids and the future generation, not simply looking at it from your own perspective, and this is the reason why. So from my perspective, the framing of this in terms similar to the 64 Act, and 64 is a pretty good reference because you're seeing people say, perhaps Obama should be behaving more like Lyndon Johnson. But in order to do so, you may have to think about what those terms are that are at stake. And if it's simply no-fault insurance, that might not be enough to get the mass movement that he's looking for, which is what he's trying to do.
Mr. Charles, I've got a question regarding your principle in determining what values we should follow. I agree with you that I think values is the way to go. I just happen to think that if we follow them, we end up with Professor Richmond. On the one hand, President Obama has to address two different camps of values. Those who are sort of waving signs saying that this government takeover, there are death panels, and those are raising concerns that the government lacks the confidence to input the system and that the policies themselves cost too much money and there are cheaper ways out there. Those are both based on values. If you're going to go for a full-fledged values approach, how do you determine where to spend your limited amount of time in addressing these? It seems that if you're trying to convince the people and evoke their emotions, you're going to be tempted to address the loudest, meanest guy in the room. And that's kind of what I think are the greater, more problematic values considerations.
I don't say that you should simply appeal to people's emotions. I think emotions are an important part of our identity, but I don't think, obviously, they're the only part. I mean, we should also, political science do and think about reason, especially the hardcore empiricists as well as the political theorists. But to use a specific example of the president's last speech, even the part that Professor Richmond liked was an attempt to frame the debate and to say, okay, you've got extremes on this side, you have extremes on that side. I'm going to leave them aside, and we're going to go for something that's much more moderate and down the middle in order to respond to the particular, for example, the point that you're raising, as well as the point that I'm raising, which is that there are worries, and the worries are at the fundamental level. They're not simply, this is for a lot of American voters, this is not simply whether this is going to add up. So even if you make that argument, and we've seen it doesn't work. So what the president did try to frame it in those terms, and it appealed even to a person, who's very, leave aside emotions, let's go for the hardcore numbers. So I think that's a very successful approach. And as a politician, I think that's the role that he has to play. And he's beginning, it seems to me, to do that in a way that's pushing the agenda more successfully than we've seen in the past. So yes, there are extremes on both sides, and you can't simply cater to the extremes, and you must encourage the polity to think through the underlying facts and reason, but there are also ways of framing the debate that takes that into account. So the point is not to ignore reason. The point is not simply to cater to emotion. The point is, how do you frame the debate that reflects our values, that takes those issues into account, instead of simply saying, these are the facts, and if you don't agree with me, then you're an idiot.
Do you think that there's anything fundamental about American economics or politics that led to this healthcare crisis? Do you think that it's a symptom of something larger, or do you think that it's an historical accident that kind of snowballed?
Yes. It's a big problem. You don't get in the big problem accidentally. There are a lot of systemic forces, and in the interest of time, we'll just say there are a lot of systemic forces instead of detailing what I think they are that have gotten us here.
Last one.
Sorry. Me? Isn't there a point where numbers, in an extreme circumstance like this, do directly appeal to emotion? And it maybe is a difference of ignorance of those numbers or disinterest in them. Maybe if people are just let
if they're made aware of those numbers, that the emotional argument just happens automatically.
I like that. There's money on the table. Hurry! There's money on the table right now. Pick it up. What an emotionally compelling argument.
I agree. I think there is a point in which you could articulate an argument simply on the basis of the core facts that can appeal to people's emotions. Again, the only question is that appeals to some people. It may appeal to economists, it may appeal to lawyers, but it may not appeal to other types of people. And when you're trying to engage in mass movements, you have to engage the mass public.
I think it appeals to everybody.